Hi, everybody, and welcome to the Technology Evangelist Podcast. I'm Dr. John Fluke, and my guest today is a really dear friend. She's one of the sweetest ladies I know, and probably one of the best dentists that I know. Uh, Dr. Pamela. Pam, I'm going to let you pronounce your last name because I always butcher it
That's
completely.
okay. And it's recently shortened, so we
Okay.
need to not mess that up. So Pam Maragliano. Hey everybody.
Hey, and Pam is also editor-in-chief of Dental Economics, for those of you that don't know that. So she wears, unlike me, she wears many hats. I just wear baseball hats. So Pam, I always start off with like kind of an origin story for people, just so people kind of know about you and how you got to the point you are. And I kind of know it, but why don't you tell everybody else kind of how you ended up where you are now?
Oh my gosh, you want me to kick this back to the 90s or you want me to kind of go from dentistry to DE?
No, that's seriously, go back to the 90s because I think that's cool.
Okay. So I either wanted to be maybe a professional hockey player or a veterinarian or maybe a physical therapist. I have no idea. Like, I didn't know what I wanted to do with my life. And so, what most people do where I'm from in New York, where you don't know what you want to do with your life, your parents send you to community college. So, I went to community college and I was like, I'm going to be a veterinarian or whatever. So I'm going to take a bunch of science courses. And then when it came time to maybe transfer to like a real college or something else, my dad's like, no, 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 not so fast. You need to become a dental hygienist. And I was like, what? Like, I didn't even floss at the time. It was like crazy. But he made my sister become a dental hygienist. She's a hygienist now. And he was like, it's a great job for a woman. I mean, this was like the old school
Yeah,
mentality back
yeah.
in the day. So don't hate me for saying that. And he was like, after you have a job that can't be taken away from you and you don't have to depend on a man, you can do whatever you want. So I begrudgingly went to dental hygiene school, fell in love with it, and then my job that I could do whatever I wanted to after became dentistry after I started practicing as a hygienist. I knew nothing about teeth. And so I was mesmerized during the periodic exam. I just couldn't believe how clever the dentists were that worked for me. I could barely spot a problem, and then they would just like have the solution right there, which I just thought was super cool. And but I worked for a prosthodontist, and I felt like, well, if I'm going to be a dentist, I have to be like them because I just have to. And so again, lack of experience, knowing nothing about dentistry, I was like, I if I'm going to be a dentist, I'm going to be a prosthodontist. So for me, dentistry meant prosthodontics. And I almost fainted during surgery. So surgery is not for me. And then, yeah, so after I went to Tufts, I went to UCLA, ultimately made my way back to Boston because it was just kind of an easier start, really. And then we started implementing Canberra into the private practice in my practice. So it was kind of cool because it kind of started in LA or no, started in California
Yeah.
and then made its way, you know, to the East Coast. And so we started implementing Canberra. We presented what we were doing to prevent tooth decay to ADA back in 2010, and we were awarded the adult preventive care practice of the year, which was like cool. We wanted a plaque for the wall, and then like we just that was sort of all we wanted, was just like the ADA to say what you're doing is nice, a little like pat on the back. And all of a sudden I became a lecturer, which was not in the plan I had in my head. But I don't know, I feel like it's a bad idea to say no to something out of fear.
Mhm.
So if my reason to say no is just because I'm scared of it, like I'm going to say yes. So I started lecturing and doing all the things. And then people started asking me to write. So I started writing, and then I became like a little section editor for dentistryIQ.com, and then editor for Inside Dental Hygiene, and then back to, and who's now Endeavor. With Dental Academy of CE and dentistryIQ.com again, and then ultimately dental economics. So it was an evolution, but a fun one nonetheless.
You know, one of the things I love about origin stories is, and you've probably had this happen too, but I've actually had people come up to me and say, like, what you do seems so exciting. I want to do it too. Um, what's the plan? How did you plan, to do this? And I'm always like, well, if you want a plan, I'm the wrong guy because similar to you, I had buddy that in the 90s, he had uh, a dental newsletter that he would, put on his computer and print whatever it was, and then he'd take it to the photocopier and make a bunch of copies, hand fold it, staple it, hand address it. And he asked me to write an article for him one time, and I was like, I I can't do that, and then I thought, well, heck, why not? I mean, I'll give it a whirl. I mean, but my first thought was, oh, there's so many people that are so much smarter than I am and so much better than but anyway, and then that little newsletter just ended up on somebody's desk somewhere, and somebody called me and they were like, hey, it's really funny. My first major thing was the ADA meeting in 1998. And yeah, I was like, what? The ADA is on the phone. I'm thinking I'm in trouble. I don't know. Anyway, it's just weird how it works because there isn't really, I don't know. I think if you have passion, which obviously you do, I think it just shows through and people are like, that's what we want.
Well, I think also there's, I mean, maybe not as much, or maybe now with influencers and everything else, but I
Right.
feel like at the time it was sort of like the right place at the right time, I think also. And there was a grind that I'm not sure everybody has to experience anymore. So, I mean, gosh, I remember when I first started lecturing, I gave a 3 hour lecture and I really didn't have an agreement with the company that was sponsoring my lecture because I didn't know any better.
Right.
So the rep that was there was like, "So, are we paying you to do this?" And I was like, I don't know. Maybe. I'm not sure." And so she was looking around the room and found whatever was left of the varnish box that everybody picked through and was like, "I got to give you something here." So she gave me what was left of a box of fluoride varnish. And I was like, people think that this is super glamorous and you're getting paid tons of money and you're just like a dental celebrity, which we all
Yeah.
know is crap. And I was like, no, my first paycheck was the, picked through box of varnish. The, and I mean, it is what it is because you do it because it's fun. It's a professional challenge. It's certainly something, a skill set that you have to learn and
Yep.
develop. And for me, I mean, it is what it is. And I feel like, you have to go through some of those things to get to the point where you're like, yeah, it'd be helpful to get my travel covered or
Right.
whatever for the, the bigger things that we want to do.
I I always kind of laugh at the whole thing of, like people think there's private jets and limos and all of that. And I'm like, no, not quite that glamorous. It'd be nice if it was, but sometimes pick through fluoride varnish it can seem pretty good at the end of the day.
It's true. And I find it's funny because same, like I feel like I'm a pretty low maintenance lecturer.
I
So
think you are.
I know I am because I've heard stories of other ones out there. And I'm like, nope, I can Uber. Nope, I don't need a ride. Nope, you don't
Yep.
have to buy me dinner before. Nope, I'm not staying up late with you. I just want to like get there, make sure I'm there, go to bed early so I can have a great day tomorrow, like
Yep.
find myself some Red Bull and be done. And that's kind of, I think all of us sort of have a routine that we would rather do than be wined and dined the whole time anyway.
Yeah. Yeah. No, absolutely. I kind of go into pregame. I just want to kind of think about what I'm doing and not, have to make conversation if I don't want to. I just rather lock in and go. So moving on, you get to see some pretty cool stuff.
Yes.
And let's talk a little bit about some of the cool things that you've got your hands on right now that you think is either going to take off or is already taking off. And you think, it's already taking off. If you're thinking this won't, you should look at it, things like that.
Gosh, there's so many things that are kind of new, and you kind of have to figure out how it's going to work within your practice. And I think also, like before, I mean, I'm going to say a bunch of things to you guys, but I think that you have to assess your team and see what your team's skill sets are and how you can implement something. Because I'm going to tell you what we've been able to implement really, really well. There's certain things that we kind of struggle a little bit to implement. And I think it really comes down to the team because honestly, if it was up to me to implement all the things that just show up in my practice, I would literally implement nothing. So it's really the team that's super helpful. But I actually took a course. At this point, it's been a few months with my office manager. I brought her with me because again, I need my star implementer
Yep.
with me. We went to one of the 3D dentist course in Nashville and it was a smile design course and it was an exocad course ultimately.
Okay.
He taught us how to I didn't really need help smile designing as a prosthodontist or as a restorative doctor. I think most of us don't, but I really didn't know the software very well. I have a 3Shape and they have smile design software on it, but to actually have something where you can export the file and print it, kind of different. And so that was pretty sweet. And so we were taught, I mean, I don't know about you, but like when I'm doing an additive procedure, say a composite or veneers or something like that, historically, I would send it out to the lab. It would come back in a couple weeks. We would do a mock try-in, make sure the patient likes it, and then it's go time.
Yeah.
And, as long as there's no major changes that we need to make, like, we've got it planned out well, life is good. But think about that. There's a lot of appointments involved. And yeah, they're not doctor appointments, but it's still chair time and assistant time.
And
And
patient time.
and patient time, exactly. And so nowadays, you can literally take some photos, scan your patient, put it into exocad, design the file, print it, and then have a little snap-on
Yeah.
situation that the patient can see. And so obviously doesn't work in subtractive type cases, but in additive cases, I think it's an incredible tool for patients to get an idea of where we're going, but also you've got a provisional ready to go, which is so awesome too.
Well, and one of the things that I think that some people are missing the boat in this is that some of the 3D printed materials are like super aesthetic now. And even if they don't hold up a long time, if you're doing like a really complicated case, like a full arch or a full mouth, or you've got an aesthetic case that, maybe you're doing, who knows, first or second buy to second buy, and you want to get it just spot on, prep it, design it ahead of time, prep it, scan that, print the temps, let the people wear those for a while, because there are situations where you've got something and you think, if you're doing it the way, we do it now, you cement the permanence and then, okay, I missed something. I've got to, go in and then try and, make changes in the mouth, which is a huge pain. But I think when you can do this with these materials that can hold up for a long time and they're going to fit, you put them in, you let the patients wear them for however long it is, 4 weeks, 6 weeks, whatever. And if they come back and they're like, well, and because if you do cosmetic stuff, we've all done this where you cement it and the patient's happy and then they come back a couple weeks and they're like, can you just like right here kind of shorten that, and then this one needs to be a little bit more round, and you're in there trying to make those changes and then polish them up and make it look good again, which is never easy, as opposed to being able to make it on the temps. And then when you get it like this, oh my gosh, this is perfect, Dr. Pam. Here's this. I wish this was the final. And you can kind of smile and go, well, actually, it's going to be, because we're going to rescan this and then we're going to use this to make the permanent. And then really all they have to do is get used to a different material, which, may feel a little different, but probably not a whole lot. What do you think of that?
I totally agree. And we were taught that provisionals should be a prototype to the final. But let's be honest, when we're prepping, I mean, I do like a full arch. It takes me like a day to do like the whole
Mm-hmm.
thing. And so I'm tired, patient's tired, they're over me, I'm over them. You're making the provisionals, it's the last thing that you're doing. And that's supposed to be your prototype to the finals. Now, I don't know about you guys, but I don't have them back a bunch of times to dial in the provisionals. I get them as close as I can. And
Mm-hmm.
obviously, if there's a major change, they'll be back to do that. And I might tweak them a little bit at final impressions or whatever. But they weren't really a prototype. They were sort of like a helper or like a
Uh-huh.
starting off point, or maybe showing where the incisal edge should be or midline or something like that, but not a real legit prototype. And I feel like we can be a lot more accurate nowadays with printed materials and milled materials.
Yeah. Yeah. No, I agree with that 100% because I don't know about you being a prosthodontist. Maybe it's just a little different, but I've cut a couple of cases off in my career of the finals because I just couldn't get them happy and we started over. And that's no fun. So I figure that if you can get it to the point where the patient says, yeah, maybe it's my patient management stuff. I'll admit that too. Maybe people have got a dialed in way of, having them sign paperwork and stuff that doesn't happen. But anyway, um, and that's tough. I mean, and especially now with the materials that we've got, if you've got somebody that you can use aesthetic zirconia on, and then you got to go cutting that off, geez, you know,
No.
your thing on like it takes your whole day to do an arch. I did I had a patient come in and he'd had a full arch done in another city many years ago, and he wanted new and he needed new. Um, and he asked me how long it was going to take, and we were kind of talking through it. And he laughed and he said, yeah, the dentist that did this the first time, we actually stopped, ordered pizza, and ate dinner and then started back up. So, it's a lot of work. And if
It's a
you can
lot of
avoid
work
that,
and
yep,
it's a long day. Absolutely.
it is.
And it's funny you say that patient management. We all have that patient. I have a patient right now. I don't know if the case is ever going to end, to be honest with you. It started in like, I don't even know, 2021. Little crown lengthening, literally, I don't know, first or second bite of bite.
Yeah.
It's not like it should not be a big deal. Um, I think we're on our 15th set of provisionals. So the
Oh,
lab just keeps making the changes that
goodness.
she wants and reprinting them and sending them to me for us to try in, and then she tells me what's wrong with them and I send them back to the lab. This has been going on and
Wow.
on and on. And
Wow.
honestly, you probably at like step 3, like normal people would have been like, this is amazing. And so it was funny. I was presenting this in Florida a few weeks ago, and people came up during the break and they were like, what were wrong with the temps? I'm like, I don't know. To be honest with you, I stopped caring in like 2023. Like, if she's happy, like it's
Yeah.
going to be what it is because everyone would have been great. Um, she's just not having it. And so, sometimes you just have to either identify those people early and send them somewhere else or just ride it out. Like,
Mhm. Mhm. I've had I've had one case like that that immediately comes to mind where I just wrote a check and I was like, I'm obviously not the person for you. Um, no hard feelings, you know, and but that's hard. I mean, it's hard. It was hard on my ego to admit that I couldn't make somebody happy, you know.
I'm a glutton for punishment, and I don't know if it's like my eyes or what it is, like, because they can tell I'm like kind of annoyed. Um, and then like I've had patients ask me if I was going to kick them out of my practice, and I'm like, no, 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 I'm in this
Yeah.
with you. I'm not, I haven't given up yet. I'm still here with you. But yeah, no, I don't know. I don't know. I must be sending something into the airwaves that they're like, am I your worst patient? I'm like, no.
You want to talk about AI a little bit since you're messing with Overjet?
Yeah, sure. So,
Okay.
yeah, we've been playing with Overjet now for a couple of months, and it's interesting. A lot of people say, and it's kind of more of an adjunct. I
Hmm.
wouldn't say, I'm using it exclusively and it takes my
Yep.
decision-making skills out of it. That's not the case.
Totally agree.
But I will say there's a few things that are pretty cool with this software that were unexpected. So, for example, when you go into the dashboard, it has your whole list of patients for the day, and it can identify some coding errors within, say, hygiene. So
Yeah.
somebody should be on perio maintenance and they're not, or vice
Hmm.
versa. They can kind of identify that, which is pretty helpful.
Yeah.
Love that. And, whether there's images that they're due for or
Hmm.
different things like just admin things that maybe you might have missed in the huddle or maybe,
Right.
whatever. It's just an extra checks and balances. So like it has nothing to do with X-ray interpretation, but it's also really good from just like an admin standpoint and making sure your patients don't fall through the cracks. Also, I don't know. I feel like it's really helpful for me to look at the periapical area. Like I feel
Uh-huh.
like it, inevitably it's nice to see, if there's a widening of the PDL and we sort of see it. It's interesting to see how Overjet interprets that.
Mhm.
And so I think it's easy for us to be like, oh, it's probably scar tissue, but it's nice to be able to see subsequent films and kind of get a sense on if it's getting larger, is it staying,
Yeah.
is it changing? So I love that. And again, I just, we're all busy. And I feel like, I don't know about you, but there's like nothing worse than being in the middle of bonding something and your hygienist comes a knock in and you're
Mhm.
like, I want to go in there and get out of there as quickly as possible. And so it's nice to review x-rays, but I'm not going to lie. I mean, if you're a practicing dentist, you've missed something at
Yep.
some point somewhere in your life. And I feel like this is just an extra set of eyes to kind of help us maybe catch something that we wouldn't have caught otherwise. And so, I feel like it's here. It's, is it like, again, close your eyes and take it as gospel? No, because we're obviously all people and we have to
Right.
make clinical decisions. But man, it's helpful.
Well, I had this epiphany a while back. I was preparing a talk on AI, and it suddenly dawned on me. It's like, okay, so the perio probe, you pick up a perio probe and you trace it around the teeth and you gauge the pocket depth. And as you do that, what you're actually doing is you're collecting data. And it dawned on me that using AI with radiographs is just another way of gathering data. It's just another tool because I'm sure you've heard it too. I've had people say, well, I'm not turning my decision making or my thought processes over to a machine. I don't want a machine telling me what to do. And I thought, well, the perio probe doesn't tell you what to do either, but it gives you information that's like, oh my gosh, look, there's disease here. And maybe they don't have a lot of inflammation and maybe it's pink, but for some reason it's 5 millimeters. And we know if it's 5 millimeters, we need to look more closely at that and figure out what's going on. And so it's just like this big shaft of light came down. And I heard this choir. I was like, it's just like an explorer or a perio probe. It's just giving me info. And I've always told patients, the more info I have on you, I think the better I get at doing my job and recommending to them what's best for them. I mean, we all see patients like I'm sure you have them where you see a name on the hygiene schedule that day and you're like, oh my goodness, every time I see this person, there's going to be 2 areas of decay, 2 new areas, and they're going to get frustrated. And it's like every time I come in but if I can find those things now, like earlier, or even just show them and they can really see it as opposed to, I mean, I love showing bite wings on a patient monitor, but you still got to be able to look at it and interpret it, which is much easier for you and I than it is, for the patient. But when those little areas are marked and you could go see it's not through the enamel yet, but that's breaking down, we either need to ream in or you got to increase your floss, whatever it is, it's just a data collection tool.
Oh my gosh. You know what else doesn't tell you what to do? The backup camera in your car.
That's a great, wow.
I mean, think about
Wish
it.
I'd have
So
thought about that.
no, but I mean, okay, no, because this is like kind of special. So my dad passed away
Hmm.
recently, and one thing my mom and brother thought would be really cool would be to give me one of his favorite cars. He was a car enthusiast,
Oh,
and I was
that's
like,
cool.
oh yeah, and I was like, okay, that's cool. And so my nephew and I took the car to a car wash so we could like wash the car together.
Yeah.
And I'm like, how am I supposed to drive this thing? Number one, there's no Apple CarPlay. Number two, there's no cameras. I'm scared. What I
Yeah.
can't mess up the guy's favorite car. And so I'm thinking about it and I was like, gosh, the things that you grow to rely upon that are just there to help you,
Hmm.
and why would we go back in time? I feel like everything else,
Yes.
dentistry, we tend to be slow. at at integrating new technologies. And I'm not saying you have to be the first. I'm
right?
certainly never the first. I'm like, an old school prosthodontist, believe me.
That's my job to break things. So,
Yes, it is your job, not mine. But I feel like, gosh, it's here. It's certainly not going anywhere.
mhm.
And right now, it's there to aid you. Why would you like slap the hand of help away?
Yeah, no, I agree completely. I mean, we've made incredible progress. I mean, gosh, I think back to when I went to dental school, because I went to dental school before you did. If you did a composite, and we only were allowed to do composites in the anterior, but you had to get your etching step checked off. And if you had etch on the dentin, not only did you fail, but you were incompetent. How could you have done that? This person's going to need a root canal now because of you. And well, we learned that isn't necessarily the case now, dude. But we've just made so much progress. And one of the things, well, because I'm so locked into dentistry, maybe it happens across all of here, healthcare, but one of the things that happens is somebody comes up with something new, and it seems like a huge percentage of the population is they're like blasphemy, you know, there will rain, fire and brimstone. I remember when I was in school, um, a company brought an intraoral camera into the clinic, and I happened to be like waiting in line for something, and I was right outside this like clinical dean's door, and I could look and eavesdrop without really look like I was looking and eavesdropping. And I remember he told the guy, "That's just an excuse to sell people unneeded dentistry." And how many times do you reach for your camera every day? You know?
Every day. Remember
Yeah.
back in the day when marketing was considered unethical?
Yep.
You
Oh
know, that
yeah.
that was like we were taught that. Like you
Yeah.
should not have anything more than your name in the yellow pages. And if
Yep.
your starts with an A, you're luckier than someone who
Yeah.
starts with a C.
Right. Yeah. So, yeah. And now it's all about setting yourself apart. And hey, real quick, just so everybody knows, because I didn't mention this in your intro, Pam also has a really super cool podcast that she does
Oh
with a
yeah.
great doctor named David Rice called Dentistry Unmasked. Give me a quick little promo for what you guys do on that.
Oh, absolutely. Thank you for that. Yeah, our podcast is fun. So, David and I are on it together, and we've got a variety of different guests talking about a variety of different topics. But the spirit of the podcast is like imagine you're at a conference or a CE course or whatever, and you're sitting there listening to the speaker and you're learning something and you're trying to think about like how it would work in your practice, or maybe it won't, or whatever.
Right.
Then course ends and then you text your friend, you're like, let's go meet at the bar and let's like legit have a real conversation about how we're going to do that. That conversation at the bar is dentistry unmasked.
I love it. I love it. I think one of the really cool things about COVID, one of the silver linings of COVID was that video conferencing and all these other things came out. And now what I love about it is, which goes hand in hand with what you and David are doing on Dentistry Unmasked, is people can just listen to people have a conversation and learn a ton from it. And just absorb some stuff because I always feel like I'm different with my friends than I'm with my patients. And being able to know what really is rattling around on the wheel when the hamster is really spinning at heart, I think there's a lot to be learned from that. I mean, interviews are really cool and self-serving. They did interview me, so I'm on Dentistry Unmasked. There's a free plug. Um,
You've been
but
on twice, right?
yeah, yeah, I've done a couple.
Yeah, no, we love having you on. You'll have to come back again.
Yeah, we did. We did one at one of the Smile Cons. I think it was Orlando,
Hmm.
for sure. And then we did the one about what happened to DPR,
Yes.
which is a whole story in itself, which we won't. If you want to know what happened to DPR, go to Dentistry Unmasked and look at that episode because we're not going to rehash that here.
Mm-mm.
So what other cool stuff are you looking at? Because I love the AI thing. I mean, we've been using it for we've been using Pearl for 3 years, and I got lucky, as you probably did. I tinkered with some of the really early predecessors, many of which went out of business, but I got hooked on that really fast. Um,
Absolutely. Same. I think I don't even remember the name of the one that we were playing with back in the day. Uh,
yeah.
and it would like you take the x-rays and then like you'd get a pop-up and you'd be like, oh, okay, time to look at it. Like this is just so automatic.
Mhm.
It's cloud-based. I could look at it right here from my house. Like
Yep.
it's super cool. So yeah, no, highly recommend you check it out and figure out which is the right one for you. Certainly I have not been sad to be implementing it, so it's awesome. Let's see, another technology, super interesting. And I think this one could potentially be really impactful, especially if you're placing or restoring implants, is interview from Perimetrics. It's really interesting. It utilizes quantitative percussive technology to assess whether or not there's mobility within the implant. And so think about what we do now. So I obviously restore implants, I don't place them. My periodontist will place the implant, send me the report, do the follow-up, tell me it's time to restore it. And what do? We just kind of restore it, right? You
Yep.
unscrew your healing cap and you're like, did it hurt? Nope, great. Did anything move? No, great. And you just sort of hope for the best. And then patient comes in for hygiene and you hope you're not wrecking the implant with the different
All
preventive materials that you're using in your practice and they're using at home. We can get into all of that later. And then
right.
basically you just sort of hope for the best until you can identify bone loss if it shows up on an x-ray,
Right.
or probing depth, or eventually something just might fail. And we could and should do better with that.
Agreed.
And so this is a cool, I wish I had it here. It's just a cool device. It literally does four little four taps on the tooth.
It's like
And
a little handpiece,
exactly,
kind
it's
of.
got
Yeah.
a little device. It just kind of rests on the tooth. You hold it very perpendicular or parallel to the floor. And you can literally do, if you're adept at it, you could do the whole mouth probably in 2.5 minutes. Lives in the hygiene room. And it, obviously, you can move it anywhere. But what I think is interesting is before we restore an implant or immediately following the restoration, you now have a baseline. So you can closely monitor these restorations. And it's cool because with depending on the reading you get, you could be identifying earlier a screw issue or a prosthetic issue versus an implant issue. Because I don't know about you, but taking off a broken abutment or taking off a little fractured piece of screw, it's kind of a nightmare. And so if we could identify this earlier, take the restoration off. I'm still a fan of retrievable implant restorations. This bonding of
Yep.
restoration freaks me out. Um, get in there and provide a maintenance or a new screw or whatever that restoration needs before something fractures. What a savings for your patient, and what
Bingo.
headache you know uh preventive for ourselves and our practices, and time, because those
Yeah.
never take the time that you wish they take.
Well, and I think there's two things on that. Number one, just to kind of help people understand a little bit better, um, I compare it to ground penetrating radar, where they put this thing on the ground and it sends vibrations out and then it can sense, what's under the ground. I mean, sometimes I think a long way, but then it can tell you what's going on. And the other thing is that, like you, I don't place implants. I restore them. And there is a doctor in the practice that does place implants. But one of the things, and she's good at it, but she knows her limitations, and we still refer on, for some of them. But the whole thing is when you don't place them, you don't really know, like, what did the surgical site look like? What did everything go exactly according to plan? What was the bone density? All those kind of things. And then as the restorative dentist, and I mean, I classify you in that as well because you have a hygiene department, you see people for hygiene, all that kind of stuff. Whatever happened that like one day or a couple of days in another office, we're now responsible for the next 20 years. And, you know, I, I had I had a family member that came in and said my implant crown came out. And I was like, huh, okay. And fractured screw down in the implant. She walked in and she was seated, and one of my assistants brought me the crown back, and she's like, here's the crown. And I looked at it, and there was this big length of screw sticking out the bottom of it. And I was like, oh. But anyway, this poor lady ended up having to have that entire implant extracted, bone grafted, start over. And when I asked her what happened, she said, well, I thought when I was, for a couple of days, I thought when I was biting on it, it felt like a little, you know, but I wasn't, is that just me or and so patients don't know that when something like that happens, that they're like, I need to call somebody right away because they don't realize the screws can fracture off in there. So I love this thing about Perimetrics being able to give you, you know what? Last time you got this reading, this time you got this reading. You're like, we got to do something because that's indicative of a bad outcome.
Absolutely, or at least a predictor for sure. And
Yeah.
I see it not all the time, but like certainly once in a while where somebody will do the same thing. Like, hey, I've got a loose implant. And you're like, okay, please be a screw, please be,
Yep.
whatever. And you get in there, and sometimes even top of the implant's fractured. And so then
Yeah.
it's game over too. And again, could that have been prevented? Probably with better occlusion, or maybe if, a night guard or whatever. But I
Yeah.
think, in hindsight's 2020, but with a fractured implant, now, just like you said, they're now going in for, another surgery. And I don't place and therefore I don't remove implants, but I can imagine that that's got to be pretty invasive. And if we could avoid that, that would be
Yep.
worth its weight in gold. And it just makes us better diagnosticians,
Yep.
and
More
eventually.
data again. You know.
Exactly. And so it's really super cool tool. So I think and also for surgeons, or if you're placing and restoring in your practice, it can technically replace an Ostel. So it's
Mhm.
not like you need to have that, So it's certainly really an interesting device, and I highly recommend you check it out. Really new actually. So certainly worth checking out for sure.
I haven't used it clinically. I've been on some Zoom calls with the company and I've seen it. I mean, I'm kind of jealous that you've got your hands on it. I may have to hit somebody up.
Uh-oh.
But yeah, no, I do. I think it's really cool. I mean, on the calls I've been with them and they've shown it and stuff, and I'm like, that thing, that's got a lot of promise. It really, truly does. So you mentioned earlier that you've got 3Shape scanner
Yes.
and you're a prosthodontist.
Yes.
How much did or do you feel that the accuracy of 3D scanners has changed how you work, I guess, or how you practice?
It's part of what we do. It's an extension of me at this point. I have a Trios 4 and a
Okay.
Trios 5. I've got both of them. The 6 came out, so I'm going to probably trade in my 4 and eventually get a 6
Right.
because you know how that is.
Oh, yeah, I know all too well.
Unfortunately. Yeah. And so it's interesting. It's part of what we do. I mean, for a few reasons. Like you think about I want to say back in the day, but it was like, I don't know, not even that long ago,
Yeah.
where
Yeah.
say patient wants bleaching trays or somebody wants, whatever, they need a new retainer or they need a night guard or whatever. You'd schedule them back for that because nobody
Yeah.
was timed for impressions in that moment, unless just something you happen to have time. Now everybody in my practice scans. And so somebody's available for a scan. And I mean, for restorative dentistry, it's absolutely part of what we do. I still do a little bit of analog, and it's really lab prescribed more than anything else. But for the most part, single units, couple units, even nowadays, obviously night guards for sure. And anything like a retainer, anything like a bleaching tray, all of those things, it's just so efficient. Perio protect trays, even diagnostics, we
Yeah.
could do a quick smile design so patients can see what they're going to look like later. I think there's just so much to the software that there's literally no going back. Like if something happened and say, like, I don't know, like somebody came in and stole my scanners, I would
Right.
die. Literally would die because Like, who wants to start over with that?
I was talking to a dentist just this week, as a matter of fact, and um, we were talking about how, once again, back in the day, let's say you do um, some additive. Let's say you're doing like some additive veneers and you're doing, just for fun, let's just say 6 through 11. Patient comes in, you try them on, they're happy, you're happy, and you're like, okay, so we're going to bond, let's bond 6 through 8, and then we'll bond 9 through 11. So you put it on 8, tack it, you clean it up, you go to 7. You tack it, you clean it up, you go to 6, and suddenly you're off, like, oh, like a half millimeter or something. You're like, this isn't quite going the way it did before we set everything. So my lab guy and I, he and this is one of the great things for small labs. I've been dealing with this guy almost as long as I've been practicing. He's my age, and he knows what I think and all this stuff. So he used to send me cases, and there would be a piece of paper in there, and it would be like bond 7, then bond 10, then go, because he'd tried them off and on so many times he knew. And then when I went digital, we got this joke where he started sending me he'd still send me the notes, but the piece of paper would say don't matter. And
Nice.
and that just became like a running joke for us, don't matter, because it was just so accurate and there was no play in the dies, or anything like that. Nothing got worn from being tried off and on the model multiple times in the lab, that it doesn't matter. And I remember when I purchased my first scanner, and the sales guy was like, you won't believe the accuracy, you won't believe how much faster your seat appointments will go. And I just thought, okay, well, you're a sales guy, of course you're going to tell me there's this huge benefit. But it didn't take me but about 5 cases to realize this wasn't sales talk, this is actually real. you know the
It's true.
accuracy. Yeah.
And the prep appointment. I would say, I mean, so depending on the day, if I have assistants that don't make temps and I have assistants that make temps.
Mhm.
And so when I have my days where my assistants can make temps, I'm a slowpoke, so my crown prep appointments are generally 2 hours, but I could be walking out of that operatory technically in about an hour. And there's all kinds of time left over. So we could side book and do all the things. So it's really interesting that you can modify your whole schedule around scanning.
Yeah.
And in such a favorable way, because I know maybe the cost is a little scary to some practices,
Mhm.
especially if they've never implemented it. But what you get in time savings and also just being able to produce other things,
Yeah.
in short order. It's just so worth it to me. And also patient monitoring. That's another thing I love. Like how many times does your patient say, like you see them once every 3 months and they're like, is is my tooth is that one there? Is that shifting? Do you notice
Yeah.
it's shifting?
Yeah.
I'm like, I mean, I don't know. How is anybody supposed to know that unless you have technology that's going to help you identify that? Like our eyeballs aren't going to remember the position of every single tooth in every single mouth. Like at least mine can't. So I'm guessing most people can't do the same either.
Well, and what's interesting about that point, which I really agree with, is I don't know the percentage of patients, but I would be willing to bet it's at least over 50% of somebody's been a patient in your office for 5 or 6 years, and you maybe even the first appointment, you notice some wear facets, and you're like, wow, you are really, I don't know whether you're grinding in your sleep, whether you're clenching during the day, you're bruxing, you're doing something, but you're wearing your teeth. No, I'm not. Okay, well, it looks like you're grinding your teeth. No, I don't. And of course, then we're like, okay, well, I can't put you in a headlock and like make a night guard, so you just let it go. But my thing is when you can bring somebody in and gosh, your teeth are getting shorter. No, they're not. Well, let's look at the scan we took on you 5 years ago, and let's look at the one we just took on you. Let's just compare those side by side. And I know most of the systems out there now too have like a time lapse thing where it will actually merge the files together and show the teeth going. And it's like, okay, you can, now I've never had somebody in that situation say, oh, well, that's wrong because I'm not doing that. they're like, wow, it's happening kind of fast. And I'm like, well, yeah, it's happened over 3 years or whatever. And then the clincher for me is I tell people, because a lot of patients don't understand this. I'm like, the shorter your teeth goes, the shorter that little nub becomes, the less I've got to stick something on to fix it. And if they're too short and I put a crown on there, you and I are going to get to be really close because you're going to be popping some of these off on a regular basis. And it's all because your teeth are too short. And then if you want to, you can have surgery done, where they and so a lot of people are like, okay, fix it. Yeah, I don't want that, fix it. And I think just being able to show we're so visual as human beings that when you can show them stuff, because like I said, I don't remember that. Is this tooth shorter? Has this turned a little bit? I,
Yeah. How do we know?
yeah.
Also, gosh, I mean, just happened. A patient, they called us over the weekend. Um, Apparently he was hungover and he fainted after the 4th of July holiday
Oh, oh.
and smashed his anterior tooth and now needs a crown and everything else. So he was kind of too like facially
Hmm.
injured, so we couldn't really take care of him. Like we
Hmm.
couldn't do anything major that day. But if you have a cast you can print,
Yeah.
now you have a best prototype for a provisional.
Hmm.
You know exactly what his tooth used to look like, you know exactly what his occlusion was, and you now can mimic exactly what he had in nature versus, okay, let's torture you and make a quick impression so I can do a wax up so I can make you a temp because
Yeah.
nobody makes cute block temps. I mean, I can if I have time, but I mean, nobody uses acrylic like we used to back in the day.
Right.
So, to be able to do that well is not easy. So, you know, it really saves a lot of time for so many different reasons. So, I don't know, the whole like scanner printer combo situation is truly, truly like something that we really will be all relying on all the time in dental practices.
Well, and in a situation like that, one of the things too that people that don't print don't realize is I've been saying for a long time that the big hang up for printing things in the office has been the design. The printers have been good for a while, but it was like, okay, well, I can print a model. That's cool. That's easy. But how do I print, like a flipper? Well, now the software has gotten so easy that you basically just tell it Flipper or like Essex, and it just says, okay, how thick do you want it? I want it this thick. And okay, blink. Here it is on the virtual model. Here's the margins of the thing. Would you like to drag and drop those and shorten them or lengthen them or whatever? No. Next. And you're printing. It's gotten to be so streamlined now for a lot of things, um, that I would rather do that than let's take an alginate, let's pour it up, let's use some slurry stone, so hopefully it sets faster. Then let's pop it out and hope the teeth don't snap off in it, when we're doing that. And then let's, trim that up to the point that we can use the vacuum former and get a suck down and then cut that whole thing out. I mean, it's like next, 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 and then okay, it's going to spit it out in, 20 minutes or whatever it is, and then we'll get you fixed up. I mean, the
Well,
amount of time to do it the old way.
let me ask you this because I think I can like hear the wheels turning for some of
Sure.
the people that are listening just even ahead of time.
Yeah.
To be honest with you, as a practice owner, I don't want to do this. I don't want to do it.
Yep.
Like there's some people that are like, this is so cool. Like, I want to do this. Like, guess what? I don't,
Yeah.
but my team needs to do it.
Mhm.
So, what's your best advice for somebody who wants to rely on the team
Yeah.
for most to all printing needs?
Okay. Thank you. That's great. So this is going to take me a couple of minutes, just so you know. Like I can't tell a short story. But anyway,
Good.
um, I was a psych major in undergrad, and I am a big fan of the word buy-in. And so whenever we integrate something major into the office, we have a staff meeting. Bring in lunch, we sit down. Depending on what it is, a lot of times I'll tell the team ahead of time, this is what I'm thinking of bringing in. What do you think? And sometimes I break them up into assistants. You guys get together and talk about how this will impact you. Hygienists, you get together, admin you. But sometimes it's just all together. But then we sit down and we red team it. And basically that's a term that means shoot holes in this. Give me the bad stuff. What could happen bad if we do this? And so we sit down and we red team it and we go through all of that. And then if somebody says, well, like I don't have time, somebody else may say, well, you know what? I normally have like an extra 5 minutes where I could do anyway. And so we work that out. And then if everybody has buy-in, nobody then comes out and says, I knew this was a stupid idea when you said we should do this. Or they don't say that, behind your back to the other team members. And then the other thing is that giving your team more cool stuff to do, like, do I design? No, no. And I should have made that clear. That's why I'm glad you asked. My team does that. In fact, this is kind of a quick vote for exocad. So we have a mill in my office, and when we brought the mill in, the mill was installed. It was in April of 2022, but I knew we were going to have to design crowns. So I literally pulled, or I polled the assistants, and I was like, who wants to learn how to design crowns? And two of them who were pretty tech literate, they're like, I'm all over it. Turn me loose, coach. So I told them, I said, here's the deal, keep track of your time. There are YouTube videos galore out there on how to design crowns in exocad. At lunch, watch them. You go home at night, watch them. If you're watching them, I'll pay you. So I'll pay you your hourly wage if you'll just watch these videos and learn. And by the time that mill showed up, these two assistants were so good at designing crowns that at lunchtime they would sit down and they would have competitions like, okay, let's do this. I'll bet I can do it faster than you. And I'd watch them do a case, not every time, but I'd watch them do it in like 5 minutes. And they literally would run the stopwatch on their phone to see how long it was taking them. And so now I don't design the crowns. I just prep, and if it goes out to a lab, I don't do the lab's job. My job is to prep. But it's the same way if it stays in-house. I don't design. I prep and they do it and they're good at it and they love it. And the one other thing that I will say that I think is really a good thing about empowering your team is, so the patient, the assistant designs, mills, polishes, tries it in, takes a bite wing, comes to me, I've got a crown going on number 30, got a bite wing. I look at it, I'm like, it's perfect. I go in, I sit down, I check it clinically, and then I always say to the patient, she tell you she made this? And the patients will be like, what? I'm like, yeah. We scanned you and that made it digital. And then she took that digital file and she completely designed and created this crown. And so this is all her work. And then she put it in this robotic milling machine we have that cuts a block of porcelain into that shape. So this is her from start to finish. And they'll look, and the two assistants I have that do that are both pretty humble. And they'll be like head down, kicking the ground, like, you did this? Yeah, I did. And they're like, that's the most amazing thing I've ever heard of. And then they're always like, she needs a raise, or, don't let this one get away. But it just makes it more fun for them. In a normal non-digital world, what's a dentist going to say? Nice job with, or I'm sorry, the patient, nice job with that big gooey tray full of gunk you stuck in my mouth there. Dental assistant, they don't hear that. And, sometimes I think wrongly, because I don't want to be a dental assistant. I've had to assist before, and I always tell the patient I'm the most overqualified and least competent person in the office to be doing this job. But, sometimes people think, well, they just vacuum up the spit. That's all they do. And so many auxiliaries are so smart, so talented, have such great hands that turn them loose. Why don't you? You know?
Absolutely. And they're going to stay with you. You
Yeah.
talk about creating culture and giving
Yep.
people autonomy and allowing them to do things that make them excited. I totally agree. It's funny though, my tactics are a little different. Basically, I'll like when we were getting into scanning,
Yeah.
or I was, contemplating buying my first scanner. Basically every time it was like, ugh, like they run out of material. I'm like, well, this wouldn't happen with a scanner. And then, oh, we've got to reschedule something. Oh, well, this wouldn't happen with a scanner. And so next thing you know, now tables are turning and now they're putting pressure on me. This wouldn't happen if we had the scanner. When's the scanner coming? And I'm like, okay,
Yep.
let's do this thing. So I don't know. There's definitely different ways to get the team onboarded and get them
Yeah.
excited about technology without a doubt.
I love that. The one disaster that I would recommend avoiding is one day something just shows up in your office and you're like, this is what we're doing now, everybody. Because I like to say, I have a little expression, life is like orthodontics. If you apply gentle pressure over a long period of time, things change. If you try and move the teeth in a weekend, nobody's happy. And it's so true, you're planting those seeds. This wouldn't happen if we had a scanner. Not like we need a scanner or just one day, what's this? This is the scanner. I threw away all the alginate over the weekend. I mean, I've heard of people doing that. And I've actually heard of people losing staff over that. I knew a guy way back in the day that brought in digital x-rays and he went over the weekend and he got rid of the processor. And the staff had kind of been fighting him on doing digital x-rays. And they came in on Monday and he was like, the processor's gone. We're doing digital x-rays now. And two people quit. They were
You know
like,
what?
how
They had
dare
to
you do
go.
that?
I had to do that. I did that. So, well, I didn't do exactly that,
Right.
but I was buying digital x-rays because the practice I bought was a dinosaur.
Hmm.
And my assistant's like, we need Fixa. That's what they say in Massachusetts. And I said, I'm not buying any more Fixa. It's not happening. I'm not buying it. We're going digital, and that's going to be how it is.
Right.
Okay. And so, sure enough, we did it. We got it trained in it. And next thing you know, there's no turning back. So I feel like sometimes you got to drop the hammer if you need to.
You
I mean,
do need to
obviously,
apply pressure. Yes,
um,
totally agree.
especially if those are going to, kind of be counter to what you're
Mhm.
trying in your practice. But yeah, no, I like that orthodontics and analogy that you're like filled with the best analogies. I love it.
Well, I don't know where I came up with that one, but I had little way back story, but I had a hygienist who was a great hygienist. I loved her as much as you can love an employee. But when we started doing digital charting, and it was like perio probing is now digital, and she came to me and she was like, I can't do that. I I hate this is in the early days of PC. She's like, I hate computers. I don't want computers. Can I just write it on a piece of paper and somebody else put it in the chart? And I was like, no, we can't do that. And we just basically we shook hands and we hugged and we agreed that we liked each other, but there's business and there's personal, and you can love somebody personally, but you just can't work with them. And so she ended up leaving. And I was sad, but I was like, this is the way it's got to be. And sometimes you got to do that. It's not fun, but life ain't always roses either. You got to deal with the hand you're dealt. So,
Absolutely. And you need to cultivate the team that's going to support you
yep,
and what you want for your practice and your vision and your mission and all the things. And I say, if you don't have them, keep looking for them because they're out there. You just need to
yep.
find them.
Well, and one other thing since COVID, dentistry's really had a hard time finding and keeping good employees. And I will say too, I think empowering them, giving them, things that they love to do that let them expand their horizons. They're not always out looking or thinking, I could make more money stocking the shelves at Target than here, holding the vacuum cleaner all day. And we don't have much staff turnover. And I think some of it, at least, is that they get to do some fun, cool stuff that lets them expand their horizons.
Absolutely. So keep them challenged, keep them excited, and you'll get to keep them.
Yeah, yeah, super cool. Well, Pam, we've been at this for a while, so we could probably go on for hours, but I know you are a busy professional lady and you got other stuff to do. So, anything you want to leave anybody with that's tuned in here?
Oh my goodness. No, just thank you so much for having me. This was so fun. And I guess get your interview and I want to hear what you think of it, John. And then let's do this again sometime.
Okay, cool. Well, you can count on that. So, everybody, um, this is the Technology Evangelist podcast sponsored by Medidenta Digital. I'm Dr. John Fluke, my pal, Dr. Pam. Thank you so very much for watching. Have a great rest of your day.